Hi, my name is Dr. Amer Syed. I'm with Hudson Health. I'm here to talk to you about several important health topics that are really, really important for us. Later on in the segment, I'm going to have a guest on who's going to speak about healthcare for the elderly. But for now, the certain pressing topics that we have to speak about are COVID, right? Again, we're seeing a resurgence of COVID coming back, especially with the Delta variant, right? And even those patients who have been vaccinated are still getting COVID. And do remember, you can still get it. So wearing masks is still very, very important. So right now, the current death rate is between 15 to 1,800 people a day within the United States, which is a lot. Now you can see the rate of children death and children hospitalization is at its peak, whereas last year it was not. So this is why vaccinations are very, very important. There's a lot of vaccine hesitancy, and I've noticed this with a lot of patients, even in my practice. Let me make one thing very clear. You can still get COVID, but you won't have to go to the hospital for it. And the COVID vaccines are very safe. You have 3 options to get either the Pfizer, the Moderna, and or the Johnson & Johnson. They're equally effective in preventing hospitalizations. So it's very vital for everyone, for a lot, especially the first responders. Now schools are open, teachers, students that are eligible, please get your COVID vaccines. This is not a virus that we can understand. It's evolving at such a rapid rate. There are more variants that are coming. I have patients that have traveled abroad who are fully vaccinated to South America, to Europe, that have gotten a different strain of coronavirus. And they suffered there. And once you get stuck in a foreign country, you will not be allowed in the United States, and you'll have to stay quarantined for at least 10 to 14 days, depending on the country's regulations. So please get the vaccines. Now, even France has shut down all travel for United States citizens unless they show proof of vaccinations. In New York City, I personally went with my sisters for dinner 2 weeks ago to an amazing restaurant in Midtown. The first thing that they asked for was proof of vaccination. I think all these things are very important, and they're very vital for the kids to come back to schools, for people to feel safe, for our economy to be robust again, just as it was before. Don't let these little things really pull you down. It's clear as day, and I've said this way before on our show. I said this last year, and I'm saying it, reiterating it again. The Black and Hispanic community is at a higher risk of getting COVID because of a genetic reason. So this is why there's a lot of hesitancy. And I know of many, many patients that are from those backgrounds that have gotten COVID, and they've been in very, very bad straits. Luckily they survived, but in doing so, they've become advocates for getting the vaccine. So please don't take this disease state lightly. We are already seeing different variants in South America, and travel is very quick. Travel spreads very, very quickly. They're saying it happened in March. It probably started in January. We just didn't know anything about the virus, but the virus that we had in last January was very different than what we have today. Now, when it comes to the boosters, there's a lot of questions and a lot of controversy about the booster shots. I personally did get my booster. I got my booster 3 weeks ago. I think it's very important, being a healthcare worker, being frontline, and treating all these patients. So for the general public, you really don't need it as of now. The health department will notify you immediately the minute you do need it. But if you're a first responder, healthcare worker, nurse, you should definitely get the booster. It can only help your immune system. Remember, your immunity wanes in 6 months, right? So despite checking blood levels or spike antibody levels, or if you think you've had COVID and you don't need the COVID shot, that is a fallacy, because we don't know whether or not those antibodies are protective. So this is why it's very, very important for you guys to get the COVID vaccine. And the more people that get it, the safer we will be as a society. Listen, everybody wears seatbelts. There's no controversy over that. You do not wear a seatbelt, you get a ticket. You drink and drive, you get a ticket because of public safety, for your own safety, for the safety of others. So please understand that and take the COVID vaccine, because together we can progress as a society and we'll feel a lot more safer for the elderly at home, our grandparents, our parents, and our younger relatives, nieces, nephews, children, etc. They're innocent victims of something that's preventable that we can do. Everybody stood up in the 50s and 60s when they had to get this smallpox vaccine, and this is why a lot of people are alive today because of that. So we'll be right back for another segment of Hudson Health. Thank you.
A brand new truck isn't just a brand new truck when it's tough enough to have best-in-class available payload and smart enough to know that a cab can also be an office. A truck equipped with best-in-class available towing that asks, why can't all that power more than just this truck? No, your brand new truck isn't just a brand new truck when it's the all-new F-150. Tough this smart can only be called F-150.
Did you know Jersey City was one of the first in the country to take action on the coronavirus? Face masks mailed to everyone. The first to offer free COVID testing. And Mayor Fulop also got direct cash relief to help residents pay rent and small businesses stay open. Now he's working to vaccinate as many residents as possible, with vaccine centers in every neighborhood and free Uber rides for seniors. Steve Fulop is my kind of mayor.
Hi, my name is Dr. Amer Syed. I'm here. I have the pleasure of having Christine Lesicko. She's the executive director at Pace Lutheran Life in Jersey City. She has an extended resume. I have the pleasure of working with her every morning. She's taught me a lot regarding the other side of healthcare besides providing healthcare. And I will let her introduce herself. So Christine, basically, can you please introduce yourself, what PACE has to offer, the benefits, the costs, and the service areas that you guys service?
Absolutely. So my name's Crystal Lesicko. I'm the Vice President, Executive Director of Lutheran Senior Life PACE program in Jersey City. I am also the President of the New Jersey PACE Association for the state of New Jersey. PACE is the program of all-inclusive care for the elderly. It is a program for seniors that are of low income. There is a financial and a medical aspect to the PACE program. The PACE program is for individuals that are nursing home level of care, that they want to stay and live in their community. As we know from COVID, going into a facility, that is probably not the best option for a senior. And what is the PACE program? The PACE program is two different lines of business under one umbrella. We are an insurance company where we are the same as an Aetna or Horizon, and then we are also the provider of care, where we are both under one umbrella versus any other insurance company in the country. We're an all-inclusive care under one umbrella, the insurance and the payer side. So what does that mean for someone who's a senior that could be faced with needing help at home or caregiver burnout, or possibly a family looking to place someone in a nursing home? They would come to a program like us. And why would they come to a program like us? Because we're an all-inclusive care. We coordinate all services. They are not services just coordinated via the phone. We take participants in and we take care of them fully. All their care, primary care, specialty care, transportation, pharmacy, meds, rehab, that is all under one umbrella in one building, all by one phone number. So if you have a caregiver that could possibly be burnt out or cannot take care of a loved one and does not want to place them in a nursing home, you would partner with us And to give you an idea of how integrated and how much collaboration, if you have a senior that comes into us, that we provide all their transportation for all medical visits, primary care and specialty care. Not only do we provide their transportation to all this care, but we take them, we bring them to their appointments, we have them register with the specialty doctor, and then we also pick them up and pick up their paperwork and bring them back home. And that paperwork comes back directly to us in live time. There is no other coordinated care in the country that can actually produce that outcome except for a PACE program. It is powerful.
I'm sorry to interrupt, but let me ask you a question. Why, and I know this being in practicing medicine for 14 years now in New Jersey and understanding the Medicaid program, when patients are given Medicaid, why isn't PACE offered as a choice? Whereas Aetna is, NJ Health is, United Healthcare is, why isn't PACE an option for family members to pick or for patients to pick for themselves? Is this at a state level problem?
It's at a state level, and it has to do with options counseling. And we do need some regulation, some legislative help on that. Many people that are in the MLTSS programs, they are auto-enrolled. Auto-enrollment is not available for PACE programs.
And so basically, it's sort of like being able to buy a car, but the government's automatically giving you whatever car, irrespective of whatever you want.
Yep, you go through a process through the options counseling, and then options counseling is putting you into a program.
I see.
Options counseling, should be fair across the board. But many of the MLTSS, they're auto-enrolled. We don't have auto-enrollment.
Working with the PACE program personally for 3 years, I don't think that any other Medicaid program does provide the level of care that PACE Lutheran does. I mean, the level of home health care, 24-hour accessibility, prescriptions delivered, etc., and review of medications, prevention of falls, physical therapy, occupational therapy. It's an all-in-one unit. So I think this is something we need to talk to our legislatures about.
And let me just add to that.
Please.
Let me just add to that. So, we have seniors taking care of seniors on limited income. And when you join our program, it's an all-inclusive care. So there are no out-of-pockets for copays, pharmacy, or transportation. So a participant or a family member is not using their own gas or need a car to be in our program to take care of a loved one that are on low income. So we also send everyone home with 1 meal a day. So that is also another out-of-pocket cost that would not affect an elderly person.
And also you guys offer dietary counseling. You have a dietitian on staff that's available to review everybody's intakes, whether diabetics, have high cholesterol, hypertension. Then you have your physical therapist, your occupational therapist, and you have amazing social work team that coordinates care from if a patient's hospitalized, God forbid, to a nursing home for subacute, and then coming back to home, and then making sure. But this is where healthcare is going now, from what I understand, is that it's that at-home care model. And so you guys have been ahead of the curve. So I think this is something that we should definitely promote a lot more so that the patients don't have to go and have to seek other professionals on their own dime, whereas there's transportation being provided. So having said that, Christine, can we take a break for a few minutes?
Yes.
Thank you. We'll be back.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets. Price to fit your budget. Installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City. 201-792-2712. Burns Brothers Memorials, Monuments, and Markers. 787 Tunley Avenue, Jersey City. Hudson County's only monument maker. Serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Ferns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Thank you, Dr. Amer Syed. Back here with Christine Lesicko, Executive Director at PACE Lutheran. So, like we were talking about, what are the service areas that PACE covers?
We cover most of Hudson County, and there are 2 zip codes that are not covered in our range. I do not have them offhand right now, but there are only 2 zip codes that we don't cover. But we cover most of Hudson County.
So also you guys do provide transportation to and from the patient's home to the respective doctors, specialists, and you have 2 very well-trained NPs that are physician extenders, and also you have a nurse who goes to patients' homes, and you have home health care. So it's an all-coordinated healthcare system, basically.
Yes.
So if anybody needs any
Transportation,
questions or any
pharmacy,
directions
meals.
as to where they should go or how they can possibly enroll in the program, where should they go?
They should call 201-499-3900. That is our main number for all services and the enrollment. You can
Okay.
also find us on the Health and Human Services website, but we were all the way down at the bottom under the MLTSS.
I see. So how can we help you expand your service area and also expand the knowledge of the general population to the accessibility of the PACE program, especially the Medicaid patients?
So we need collaboration from all primary care providers across Hudson County. Okay, it all starts with the primary care provider, the FQHCs, any senior that is going into an ER once or twice a month, especially at the end of the month. We know those seniors are hungry. They know they go into the ER for whatever because they're running out of money. They should be referred to us. But the barriers that we have, the real barriers, are physicians are afraid to go from their MLTSS because they have contracts with them, large contracts with them. And they're afraid of the competition or that they may be jeopardizing their contract. This is a lot of what I hear. We are also in the Christie Kerr building. We've had asked several times to solicit the physicians here for referrals. And we've been given pushback because physicians are afraid that they may lose 1 or 2 participants. Every physician across the country has 1 or 2 participants that they cannot know and 1 visit a week or a month. Those are the participants that should be referred to us. They are the ones who need the most care and that we can take and really extend their life. We have a lot of participants with us that have been with us for 10 years, and they're all nursing home level of care. And that is just amazing in itself, the statistics of PACE.
No, absolutely. The outcomes I see every day and the advantages I see every day. So I really want everybody to realize that there are programs like PACE, and I've referred personally from my private practice several patients over, and they're very happy because the inclusivity of all the providers that they need to see, the proximity of the providers they need to see, and they get all their dietary needs met. I oftentimes have patients in my private practice who have commercial insurance who don't know where to go for dietary services. They have no access to dietitians. So this is a great program for those low-income Medicaid, Medicare patients that have no other options. And instead of being home alone, lonely, COVID, all these issues, there's so many issues that are plaguing society right now, especially Hudson County. the paucity of services. And this is a great program for everybody to look into and really get into. Can you please repeat the phone number so that people can call?
201-499-3900.
Okay, so you guys heard it twice. So please call. If you have Medicaid, you're 55 and above, and you have multiple medical needs, this is a great program. And you will see that not only does your health get better, but you'll eat better and you'll be guided better. I just want to take this moment to thank Christine so much for taking out her time. I know how precious her time is. She's a very busy lady, and we look forward to having you back on the show again.
All right, thank you.
Thank you, Chris.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one path stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer a Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
When you have 3 children who are police officers, you worry about them every day, but you are also proud. Under Mayor Fulop, 70% of new officers in Jersey City have been minorities. Mayor Fulop also upgraded our public safety cameras with over 200 new cameras and body cameras on officers, protecting citizens and police officers. Steve Fulop is my kind of mayor.
Hi, it's Dr. Amer Syed. I'm back again for another segment for Hudson Health. Leading into this talk, what I was talking about before was the topic about COVID. But I also do want to remind everybody that there is something called COVID fatigue that the generalized population is feeling. Everybody's talking about COVID. Nobody wants to talk about COVID. Everybody's in denial. People want to take off their masks. People do not want to socially distant. And this is why the Delta variant now is spreading like wildfire, right? And the more spread it does, the more mutations it becomes. The Lambda virus has already been identified in South America, and God knows what other mutations are yet to rear their ugly head. Do remember it's the fall season, right? And in the fall, we usually go ahead and get our flu vaccines. Do remember, the COVID vaccine is an mRNA vaccine. So you can get the COVID vaccine and the flu vaccine actually on the same day in different arms, right? So there's no contraindications to that. So last year, we didn't worry too much about the flu because everybody was wearing masks. If you want to continue wearing a mask, that's great. That does mitigate the risk of you developing the flu. But again, being a healthcare provider, I highly recommend that you go to your closest Walgreens, CVS, or your healthcare provider, your primary care provider, to get your flu vaccine. Across the country, we're seeing a lot of nurses, a lot of doctors that are completely burning out because of COVID, because of taking care of people who are refusing to get the vaccine. Remember, now this has become, unfortunately, a disease which has become politically polarized, and that's something that should never have happened, right? I got my parents vaccinated very early on last year, so I would not recommend this for anybody. that I wouldn't recommend for my parents and or my family. And the cutest thing was that my niece, when she turned 16, when I asked her what she wanted for her birthday, the first thing she said, she's like, I don't want anything else. I have everything. I just want the COVID vaccine. So we got that arranged, and now she's so happy about that. So please, the burnout rate for nurses and doctors is very, very high. The ICUs are filling up. ERs are filling up. I had a friend of mine who called me from Staten Island. He was taking his 83-year-old mother to hospitals there who didn't even have medication available because of so many patients having COVID. So please don't take this disease lightly. There's a lot of doctors, nurses that are quitting their jobs. And if we don't have them working the front line, then who do we have? We're left to our own demise, right? So let's learn from the past and let's become a healthier, look forward to a healthier and brighter future that can help everybody. The other thing I want to speak to you guys about is the role of COVID and developing long-term symptoms from COVID. Now, mind you, you might have mild symptoms, you might have moderate symptoms, and or severe symptoms. They last for that time. But there's so many articles that are being published and so much data that's coming out that we're learning about that long haul syndrome. Everybody is suffering the long-term effects of COVID, which includes chronic fatigue, hair loss, lack of interest, depression. We have a litany of diagnoses of patients that are becoming very ill on the long term, not able to complete their jobs, not being able to carry their equipment when it comes to frontline workers. So we have to realize that this is not something which is going to afflict you for 7 to 10 days. This is going to carry on for years to come. How long, we just don't know. Having said that, please understand the entire pharmaceutical company working with the government and all the scientists out there are feverishly working at more and more treatments for this. This is a disease which can and should have been eliminated if everybody had gotten vaccinated. So this is why I still urge all those 50% of Americans that have not been vaccinated to please do so. Don't believe that anything that you read on the internet is true. We have no incentives to do this. There's no chips being inserted. There's no magnets being inserted. Do you know a chip probably costs $500 to $600? The vaccine itself costs $37. So it doesn't even make sense. So if anybody's going to track you, they can track you through your cell phone. It's not something that it actually doesn't even make sense for you to even think about something of that sort. So please, any vaccine hesitancy that you guys have, please speak to your primary care physician or your healthcare provider about them. We all got it done. 97% of physicians are vaccinated in the United States. This is fact. Why did we get vaccinated? Because we know better, right? And we're trying to help everybody. We want everyone to be better, and we want our society to come back to normal, just like we were before Corona, right? So having said that, in closing remarks, thank you so much. We'll be back again to shoot another segment for Hudson Health.